Well, as the world fights the COVID virus, there are so many questions being asked on where we actually stand at the moment as far as the hunt for a vaccine is concerned, medication is concerned. When will travel open up around the world? When will things be back to a normal that we'd known just a few months back? Well, one of those key individuals looking at the overall situation in the United Kingdom, Dr. Chaand Nagpaul, chair of the British Medical Association Council, joins us now. Thanks very much, Dr. Nagpaul, for being with us. There's been a great deal of scrutiny on the Oxford vaccine. Since Lancet came out with that document which had a peer review of the Oxford vaccine, where has it progressed till so far?
Well, actually, we're given encouraging news that the vaccine development is progressing well. As you know, not just in Oxford, but globally, there are initiatives where there is some initial testing. But the government in the UK, as well as in other nations, is being very cautious in not promising any specific timescales. And as far as we're aware, we still need to plan on the other side of this year into 2021 before a vaccine will be operational. That's the sort of caution we're being advised.
And phase 3 trials obviously are really important. Both the Wuhan vaccine candidate and the Oxford vaccine candidate and others also are progressing towards in phase 3 trials. How important is that before we find a solution?
Well, it's of course important when you consider that the vaccination of people to immunize against coronavirus needs to work. It needs to be widespread. So there needs to be scientific confidence that this will work. Of course, that's important, which is why I think that the UK government and others are being cautious not to promise anything at this stage. And that means that as we speak now, there needs to be real efforts made to control spread of the virus rather than relying on a vaccine, which of course we hope will happen sooner rather than later. But until such a time, our efforts must be to control spread of the virus.
And there's a big effort, a big concern, I should say, about the situation in the United Kingdom and the possibility of a second spike in winter when several other ailments normally do make an appearance. Could it be, is it a worry that COVID could piggyback on some of these other infections and make the overall situation bad as far as COVID is concerned?
Of course, there's a real concern in the UK and in other nations that have winter coming up, because of course in winter we see many more illnesses that can mimic the symptoms of COVID-19. We have every year a winter flu outbreak, and that can also be quite widespread. And those symptoms will be similar to that of COVID. So it's going to be a challenge for the UK, but that is why the call that myself, on behalf of the British Medical Association, are putting out to government is that they must now do everything possible to contain, to suppress the virus so that we reduce the infection rates well before we reach winter.
And, you know, we've been speaking about vaccines earlier on. What about drugs which are already available? Drugs, for example, like remdesivir. In your opinion, to what extent are patients having their lives saved by the availability now in increasing doses of these drugs?
Well, one intervention which was introduced, in fact, in the UK is the use of steroids. Prednisolone for patients in hospital, which has been shown to reduce the duration of the illness and improve outcomes. As for other drugs, of course, they're being used, but I still come back to the point that these are measures to alleviate the illness when it has actually affected someone who's in hospital. From a public health perspective, I believe the efforts need to be redoubled in all nations to prevent people getting infected and to prevent spread. That is what some nations have successfully done, and we need to learn from those examples, because rather than sort of focus on treating people who are ill, which of course we must do, we will gain much more if we prevent illness and prevent spread of the infection in the first place. And I believe that in most nations there is considerable scope to make additional efforts. Because remember, the virus is as infectious today as it was at the beginning of the pandemic. It's the same virus. And if we're not careful, it can spread without notice. And that's what we've seen in countries like Spain, which a few weeks ago were only having a few hundred new cases. Now it's in several thousands. So we need to be very careful, because the world is now trying to adjust to a new norm. We're seeing the public resuming normal activities, because of course you can't have society locked down forever. But what needs to be done by all governments is to make sure that as these lockdowns are eased, that people aren't resuming normal living in a normal way. We have to make sure that there are real safeguards and restrictions as people begin to resume normal living. Otherwise, we will see new spikes, and even a national spike if we're not careful.
One final question. There are thousands of students from India who travel to the United Kingdom. I mean, everywhere around the world, there have been massive disruptions in education, of course, the movement of families as well. When do you actually expect to see a further opening up of travel to the United Kingdom?
So the United Kingdom should follow the same rules as all nations should follow, that we need to safeguard the health of people. That includes those citizens of a country, but also those who come to the UK. And I don't think it's right to make policies without, first of all, being clear about the level of infection in a nation. So if you've got, for argument's sake, rising infection, as we've seen specifically in some pockets of the world, you wouldn't want to see an increase in international travel to that country, because that will put at risk those traveling to that country, but also add to the problem of containing the virus. So I think the first thing is that I would hope, and this is what we've been putting pressure on the government to do, is that during these summer months, to make every effort to lower the infection rate to a level where we can feel confident that we can resume more travel into the UK. But that requires the UK to have a low and sustained level of infection. And of course, the UK, and I speak as a doctor, we rely on the medical workforce from India every year to come. They come and train here, and those doctors provide a service to our National Health Service. So of course, I would like to see restrictions eased, but what we cannot do is put lives in danger by doing it in a non-evidence-based manner. And that's why the government needs to first reduce infection rates.
Dr. Chaand Nagpaul, pleasure speaking to you. Thank you, sir, very much for being with us.